Despite containing the Ebola virus disease, health officials in Nigeria still work round the clock to ensure the countries continue to remain Ebola-free. The country has kept its borders open but has now stepped up screening. At its busiest seaport in Lagos, health officials now conduct Ebola screening on every crew member of vessels that berth there. I was actually there earlier to witness how the screening is being done. Take a look. The MV Pintail, a separate registered vessel that arrived Nigeria on Sunday. It's carrying gypsum, a product used in making cement. And Nigeria's Port Health Services officials are boarding the ship to screen every crew member to be sure none has any symptom of the Ebola virus disease. The captain summons his crew to this small conference room on board the vessel for the screening. Port officials want to see what else is on board among the crew, so their temperatures are checked for anything abnormal, especially Ebola. Any abnormal temperature reading would be a potential red flag. And this is the second time health officials would be screening the crew since the ship berthed at the port.
For every ship that arrives, Port Health is required and mandatorily boards every ship to give them a free pratique. What that means is clearance that they can get off the ship and that other agencies can board the ship, meaning that the health status of the ship and the crew has been certified. Now, because of the Ebola outbreak screening activities, in addition to that, we administer the primary screening form, which they fill out, and a temperature check is done. Now, for any crew member who may be unwell or who may have a raised temperature, every terminal, like the terminal we're at now, has a clinic. And so we have trained them and we work closely with them. The Port Health Clinic is also located here. And then the crew member is triaged. If it's an Ebola suspect case, then they're evacuated to the isolation center. Otherwise, they're treated medically.
Ebola has largely been contained in Nigeria. Not a single person is known to be under surveillance for the virus across the country. But health officials say they are not taking chances.
As long as other countries in the sub-region still have an outbreak, we're persistently at risk. Basically because you have passengers who still transit by air, by land, and by sea. So we need to be sure that they're not bringing anything in, and we need to be sure that there's no cross-border transmission. So for the ports, regardless of whether it's a ship that has passed through affected areas or not, the procedure is the same across board.
But so far so good. Nothing abnormal has been detected. They're still going to continue to take the temperature reading of the crew members until the ship leaves the port here in Nigeria.